Do you struggle with under-eye bags, under-eye dark circles, fine lines, wrinkles? Does this area of your face just drive you crazy? If so, this video is for you. So I wanted to do a video on under-eye rejuvenation. Under-eye rejuvenation is probably the most common requests that I have in my office, seeing hundreds of patients each week. And the under eye is the first to show our age. Even without changes with aging, just anatomically, people could be set up for problems under the eyes, whether it's under eye bags, under eye hollows, kind of like sunken eyes, kind of puffiness under the eyes. And it doesn't even happen to be or always have to be a problem with aging, but it could just be a genetic predisposition that gives you an anatomical deficit that you want to correct over time. So after watching this video, it's an updated video. I've done other under eye rejuvenation videos in the past, but I want to include some of the newer treatments and combination of treatments that we've been getting amazing results with in our office every day with very happy patients. There's so many different changes that happen under the eyes, and there's different targeted treatments that we can do to help rejuvenate the under eye area depending on what changes are happening. Sometimes there's volume loss with rapid weight loss, or sometimes there is volume loss because of aging, or sometimes there is a decrease in the collagen and elastin because there is a drop in estrogen, or maybe there are different changes that are happening with other things that are happening in the body, or just with aging, or just anatomical variants that may be present even early on that may not really present until they become accentuated later in life. For example, if you're born with kind of hollowing under your eyes or sunken eyes in your 20s, it may just kind of be annoying by having a little bit of dark circles under your eyes, which you can kind of correct with concealer. But as you get older and gain wisdom and have birthdays and hit your 30th birthday and then get into your 40s and 50s, these under eye changes become more pronounced as the skin thins, as the dark circles become more prominent, and as changes become accentuated. So after watching this video, hopefully you'll understand how to combine different treatments in the office, quick and easy procedures that will help give long-term, beautiful, well-rounded results to help your under eyes look their very best at every age. So one of the most significant changes that happens under the eyes is a loss of collagen and elastin, the extracellular matrix proteins that give skin a smooth, tight contour. Now, babies and kids have a ton of it, and you start to lose your collagen and elastin when you enter your 20s. And so you'll start to see, maybe not at rest, but when you smile, you'll have fine lines and wrinkles under your eyes that you didn't have before. These can become more pronounced as you reach 35, 40, 50s, 60s, and beyond. So during the perimenopausal period or in the menopausal period, when estrogen and hormones drop, estrogen, progesterone, even testosterone drops, and you're having a downregulation of synthesis of collagen while you're also having a rapid accelerated rate of the breakdown of collagen, this just wreaks havoc on the skin. And the under eye skin is the thinnest skin on our face and the most susceptible to thinning of the skin and showing the signs of aging with fine lines and wrinkles, which may not be apparent on other areas of the face just yet. So I always say this, the under eye area, the skin is thinner, the epidermis and the dermis are very thin, and so any drop in the extracellular matrix proteins, collagen and elastin, is going to present with under eye fine lines and wrinkles. Again, this is going to appear sooner under the eyes than any other area of the face. The neck is a close second. So what we can do to upregulate collagen and elastin synthesis by the fibroblasts, which are the cells in the skin that make these extracellular matrix proteins, can come in a variety of forms. Now, it could be a laser, a Fraxel, or a CO2, or an Erbium resurfacing laser can help superficially stimulate collagen and elastin to help smooth the contour and tighten the contour of the under eye skin. Thermage is an energy-based device. There's other energy-based devices that are my favorite, but for the sake of completeness, I'll include them in this video. That includes like soft wave, thermatite, Ultherapy, and other tightening devices. I'm not the hugest microneedling fan. If you want to refer to my other videos, you could see why. But basically, energy-based devices like Thermage, for example, which uses heat in the form of radio frequency to stimulate collagen and elastin, can stimulate these production of these elastin and collagen fibers deeper in the skin. So sometimes we'll combine lasers, which are more superficial, with energy-based devices, which are deeper. And when you combine those two, you have a full thickness collagen and elastin stimulatory effect, and that's what we call biostimulation of extracellular matrix protein synthesis. And in English, what that means, you're just making your skin tight on the superficial portion of it and on the deeper portion of it, and that gives rise to smooth, beautiful, tight skin under the eyes. Usually it's one treatment with Thermage, for example, and sometimes with lasers, it will be anywhere from 2 to 3 treatments spaced about 1 month apart for the most significant results. So when we use lasers, remember on cross-section, when we look at the skin, lasers treat the top superficial layer of the skin, but energy-based devices get the deeper 2/3 of the skin. So when you want full thickness stimulation of collagen, we usually combine these treatments. And because there's usually only one Thermage treatment that's needed, and usually 2 or 3 laser treatments that are needed in combination with the Thermage. Say that it's a Fraxel, that's what we call Thermofrax. It could be like a Erbium on top and a Thermage underneath. It could be a CO2 with a Thermage underneath, or it could be Fraxel with a Thermage underneath. And you can kind of mix and match these depending on the severity of the under eye fine lines and wrinkles and how much stimulation of collagen you want to have. Okay guys, I'm on this flight. I have like my full YouTube stuff here. People are gonna get mad. So laser resurfacing will stimulate collagen superficially. Energy-based devices like Thermage will stimulate collagen deeper in the skin, like the deeper 2/3 of the skin. So when we want full thickness collagen stimulation to really tighten up the under eye skin, we'll combine these. For example, Fraxel and Thermage combined, we refer to as Thermofrax. So usually if people are just having laser resurfacing, it requires multiple treatments. For best outcomes, it's usually 3 treatments spaced about 1 month apart for laser resurfacing under the eyes. Now the laser doesn't have to be a Fraxel. It could be, a halo, an Erbium, a CO2, a fractionated CO2. This may vary, and with different levels of aggressiveness of the laser, the better the results will be. So ablative lasers are always more aggressive and stronger than non-ablative lasers. Fractionated lasers versus full field lasers are a little bit less aggressive, but are kind of the mainstay of therapy because it translates to less downtime and less discomfort during the treatment. So when you have a Thermage treatment under the eyes, some people just do this as a standalone treatment. Usually the results last about 5 years. It's not painful and there's no downtime, and it's safe for all skin types, which makes it one of my favorite treatments for the under eyes. I've done it 4 times in my lifetime. And, now that I'm 47 years old, I'm really happy with, the collagen banking phenomenon of it. And it's really helped keep my under eyes, nice and tight over time. I also do lasers, and I'll do this periodically.
Number 2, departure flight 10, please be seated.
I'll do those laser resurfacing periodically throughout the year as well. So laser resurfacing does have downtime. It's usually some redness, some swelling, but it's not painful and it's very well tolerated. It's also important to understand that a lot of physicians or providers are not comfortable doing lasers around the eyes, and rightfully so. It takes an extra level of skill and training. And if a provider is saying, no, you're not a candidate for under eye laser because, for whatever reason, it's usually because he or she is probably not trained, to do periorbital resurfacing or periorbital, meaning around the eye treatments. It also requires the placement of an intraocular eye shield. Intraocular eye shields are not painful, they're not uncomfortable. Sometimes patients who are squeamish about having things placed in their eye, need a little bit more hand holding, but it's very tolerable, it's very comfortable. We put some numbing drops inside, the eye that look and feel just like normal eye drops, but it makes the placement of the intraocular protective eye shield much more tolerable. It's just like a big contact lens that gets placed in your eye. Now, the reason why for obvious reasons, you want to see a laser specialist who's very well versed and highly trained when treating around the eyes. But should one mistake one intraocular eye shield for the other, for example, it's a certain eye shield that needs to be used for lasers, which is different than the intraocular eye shield that we use for energy-based devices. So, for example, if somebody's having Thermofrax, they're having, laser on the surface and Thermage deeper under the skin, you have to use 2 different pairs of eye shields. So what happens is we'll put one pair of eye shields in, do the treatment, take them out, put the other eye shields in that's correlating with the other device that we're doing, take them out, and then they're done for the day. And it's really important because if you use the wrong eye shields for the wrong device, it can be catastrophic. The plastic eye shields that we use for radio frequency and energy-based devices would not perform well and could actually cause a lot of harm if they're used for a laser. The laser eye shields are not plastic, they're actually metal. And if you use a metal eye shield with an energy-based device, that would be very catastrophic. So hopefully people who are not, when I say people, hopefully providers who aren't comfortable with placing intraocular eye shields or messing with the skin around the eye, they shouldn't be performing these treatments on patients. But it doesn't mean that it's not an option. We do it all day, every day. You just have to find a laser specialist, and device physician who understands how to work these machines, how to work these devices, and how to do it safely with a very low to little or any at all, hopefully no complications. So education is really important in empowering patients and subscribers who follow this channel. It's really important for me to get that information to you. So let's talk about injectables. So injectables under the eye can actually rejuvenate the eyes as well. Unlike energy-based devices and lasers, which are more long-term because you're inducing your body's own regenerative processes to make collagen to help correct, to tighten and smooth out the under eye skin, injectables are usually more temporary. So Botox, which is a neuromodulator, or any other neuromodulator for that matter, it could be Daxxify, Xeomin, Jeuveau, Dysport, whatever you choose to use under your eyes can be effectively and safely, for the most part, injected to kind of smooth the under eye area. Now, not every patient's a candidate for under eye neuromodulator because sometimes it can change the shape of the eye, or it can change the inferior part of the periocular or the orbicularis oculi muscle that can actually make your eyes bigger or show a little bit of scleral show, which is, I would point, but I can't use my hands because I'm holding up a light. If you do too much Botox under that area, here, I'll try to do it. It drops the eye, and you can see a lot of the white part of the sclera underneath the iris, and when the eyes scan a face and the brain perceives certain things as aesthetically pleasing or not, if there's what we call scleral show, and there's the white part of your eye like this, it just doesn't look aesthetically pleasing. So you have to be really diligent and careful with the number of units and the placement of the Botox under the eyes. But when done properly and correctly with the right patient, it can really have dramatic improvements for under eye fine lines and wrinkles. Now, you can't use too much in that area because it's a very delicate area, and for some people who aren't candidates, it may change the way they smile. So it's always good to start with a provider who is conservative and can kind of just test the waters, and then kind of go half the dose or a baby Botox dose to see if you like it. And if you like those results, then you can, look at Justin. Sorry, boo. And then you can adjust the dose accordingly. You can always add more. When injecting Botox, it's always better to be conservative, start low, go slow, and titrate up to a higher dose as patients tolerate it and they're like, oh, I like these results now, I'm comfortable doing more. But you never want to overdo that area. Okay, moving on to the next injectable, under eye filler or tear trough filler. We typically use Vobella. It's I think the only FDA-approved hyaluronic acid filler for under the eyes. However, now we're coming out of an epidemic of these overfilled faces and people injecting way too much filler in the wrong dermal plane and making people look weird, and this epidemic of these overfilled puffy faces that look weird. A lot of people are shying away from tear trough filler, but when it's done correctly, using a cannula placed correctly in the right patient candidate, it really performs really well. But we're seeing a lot less of it in the office, and we're incorporating more EasyGel now. So if you guys want to refer to EasyGel, I've done YouTube videos on EasyGel explaining it, but it's an alternative to filler that does pretty much the same effect as filler with respect to restoring volume, and it also kind of has the added benefit of brightening the under eye, stimulating collagen and elastin, so you tighten the under eye and you also correct for that sunken look or tear trough deficit, that volume loss under the eyes. So we've been getting amazing results with EasyGel. I incorporated it into my practice about a year ago, and we're seeing patients a year out now, and patients are doing great. They love it. I love it. I'm a huge fan of it. It's better than traditional PRP or PRF in that it is processed slower in a different protocol with the heating and cooling of the blood products that are harvested from a blood draw. So it does require a blood draw for this treatment, but the way it's processed, nothing's added to it. There's no chemicals or additives added to the blood products, but it's chock full of growth factors, stem cells and proteins, and rejuvenating peptides that are from your own blood. So it's a very natural approach, a very clean approach, and a safe alternative to filler for people who don't want to go the tear trough filler route. Okay, guys, comparison of tear trough filler with EasyGel. EasyGel, it's your own blood products. It's natural. Nothing is added to it. Tear trough filler is a foreign body substance, which is hyaluronic acid filler that is injected into the under eye area. The complication risks with filler include Tyndall effect, migration, and over-volumization, or that fluctuant kind of puffy look that you can get after the product gets partially metabolized, and those will last a little bit longer. PRF or EasyGel or PRP doesn't last as long as tear trough filler, but you have the benefit of it being your own blood products, and it has a lower risk of, really migration's not an issue with it. You don't have to worry about the Tyndall effect, and it looks very natural. The downside is that it takes multiple treatments, usually 3 treatments to get to your endpoint goal. And then the other downside of EasyGel is that it requires a blood draw versus, tear trough filler. Traditional tear trough filler obviously does not include a blood draw. Now, I know you guys are going to probably ask about microneedling under the eyes. I'm not a fan because I've seen too many people have complications with thinning of the skin, hyperpigmentation, infection, and scarring with microneedling under the eyes. So I'll refer to a different video if you guys want me to talk more about microneedling. I know that it's a very popular and very widely available treatment. Just because it's widely available doesn't mean it's the best. There's thousands of McDonald's to every one high-end, high-quality steakhouse. So just because they're more, available and more popular with more marketing doesn't mean that it's better. So I'm not a huge microneedling fan. It's an easier procedure to perform and doesn't require a high level of skill for the extenders, but it doesn't really compare to energy-based devices or lasers. I've been doing this a very long time, over 20 years of practicing dermatology, and I've used everything. I've used it all and have done, head-to-head comparisons myself, and there's just too many complications with microneedling, when compared to other treatment options, especially laser resurfacing. So my favorite lasers for the under eye include, Fraxel, Erbium if you want something a little bit stronger, CO2 or fractionated CO2. It all just depends on the severity of the fine lines and wrinkles, the skin type of the patient, the downtime, the fear factor, and the pain tolerance. So these could widely vary, but all of these lasers just do an amazing job of resurfacing the under eye area. Trust me, I've been doing it under my eyes since I was 22 and I'm 47 now, and I'm really happy that I did. So microporing. Microporing is Elipore. That's a common treatment that we use for the lower face laxity. We use it off face and off label for neck laxity, inner arm skin laxity that needs tightening, abdominal skin tightening. We use Elipore a lot, but we cannot use Elipore, which is also known as microporing, for the under eye area. And the reason is because the handpiece for the Elipore is not engineered to treat that thin, delicate skin. So although I love microporing and Elipore for other skin tightening areas, not for the under eyes, and it's not FDA approved for the under eye area anyway. So let's talk about biostimulatory fillers, because I know a lot of people are going to ask about Sculptra, Radius, and I'm an American physician, so there's a lot of biostimulatory fillers that are available overseas that are not available in the US, but biostimulatory fillers like Sculptra or Radius are not indicated for the under eye area. So it's a high risk area. They don't perform well in that area. You can have complications with lumps and bumps, and it's just not an area that you would want to use for biostimulatory injectables. Now, PRP or EasyGel is considered a biostimulatory injectable, but Sculptra, Radius, Sculptra is polylactic acid, Radius is calcium hydroxyapatite. Those are ones that you do not want to inject for the under eye area. Now, I know some people are going to ask about threads, smooth threads and other types of threads. I've used smooth threads under the eyes. I went through phases in my career where I've used it and a new smooth thread would come along and, get a lot of hype, and I've used it and it was just not very. I'm so glad that guy closed his little cabin. Okay, getting back to threads. I love PDO threads for certain patients who are trying to achieve a certain goal with a certain skin type. But for under eyes, smooth threads are not where it's at. It's not my favorite. I've gone through phases in my career where I've used smooth threads for under eyes, and I feel that there's much better ways to rejuvenate the under eye area than using smooth threads. Although I like smooth threads for other things, sometimes for perioral lines, definitely for lifting up on lower face laxity and neck laxity in certain patients, but not my favorite for the under eyes. It shows through and it doesn't even really do that much to boost collagen, in my opinion. Okay, peels, y'all. Peels are a good thing for under the eyes. I personally don't do peels in my office because I have lasers, and so why would I do peels when we have these amazing lasers? But I do have a couple of oculoplastics colleagues, friends of mine, who do phenol peels under the eyes, and I feel like that could be very effective. Sometimes you can combine a peel with a laser. The peel will kind of remove that stratum corneum layer, the top layer of the epidermis, and then the laser that comes subsequent to that is more impactful. And that could give really great results. And I think they are a really great treatment. I just feel that stimulating your body's own regenerative processes, anything that's going to stimulate collagen, has better long-lasting natural results. Peel will look great under the eyes for a smaller amount of time, but it doesn't do so much with respect to stimulating collagen. It just kind of denudes the skin on top to, help renew and refresh the skin. But the key to under eye rejuvenation is replenishing the collagen that's been lost. Trust. Okay, guys, last thing I'm going to talk about is topicals for under eye rejuvenation. So topicals for under eye rejuvenation, the number one topical is using sunscreen. I use the Color Science 3-in-1 Total Eye. Usually I'll put my under eye serum on first. I usually use my ECM eye serum, and then I'll put my 3-in-1 Color Science, which has like a little concealer tint to it anyway. And it's going to protect you not only from UV light, UVA1, UVA2, and UVB light, but also blue light from your devices. All the blue light that's hitting me in the face now, all this blue light damage that's happening on my skin, I'm protected because I have my Color Science 3-in-1 Total Eye under my eyes, and I actually have my Color Science Flex on my face right now. But that will over time be really impactful. So all my younger beauties, always make sure you're putting sunscreen under your eyes. And the one that I like that's specifically engineered for under the eyes is the 3-in-1 Total Eye by Color Science. Also for under eyes, it's important to use an eye serum. So there's a lot of controversy online, but for those of us who are truly, highly trained, board certified dermatologists, also those of us who are Mohs micrographic skin cancer surgeons and look at skin under the microscope for decades, you can appreciate histologically that the skin under the eye is different than the skin in other areas of the face. It has a different glandular composition, the epidermis is thinner, the dermis is thinner, and the vehicle delivery systems have to be a little bit different for eye serum delivery of the actives, whether it's anti-aging polypeptides, ceramides. I'm not a big fan of retinol or vitamin C for under the eyes. I love it for the skin on the face. Not my favorite for the under eyes. The only exception is having it in a hypercellular eye mask. So when you have retinol or vitamin C or AHAs in an eye mask, depending on the formulation of the eye mask with the hydrocolloid kind of mixture and matrix, it's a little bit different. But putting straight up retinol or vitamin C under the eyes, I'm not a huge proponent of. It can cause irritation and hyperpigmentation, which can worsen dark circles and things of that nature. For the under eyes, you want actives like in my ECM eye serum that are going to vasoconstrict, which is going to brighten the under eyes by vasoconstricting the ectatic blood vessels under the eyes. So caffeine, retin polyphenols, niacinamide, DNA repair enzymes, polypodium leukotomas, and natural moisturization factors. I can go on and on, but there's specific under eye actives that perform best. And when it's in a vehicle delivery system that gets those actives exactly where they need to go, it just knocks it out of the park. One more thing that I wanted to include is V-beam laser. V-beam laser doesn't do as much for collagen stimulation, but it's great for people with under eye dark circles. It helps treat those under eye vessels, those ectatic vessels that kind of show up as a blue-purple darkening under the eyes, especially as we gain wisdom and have birthdays and our skin thins. Those dark circles become more apparent. Sometimes genetically, there's even kids that have under eye dark circles. And that's more an anatomical variant, but that can worsen over time as the skin thins over time and those dark circles become more apparent. V-beam's a great laser to address that. Usually you need 3 treatments spaced about 1 month apart, and the downtime's not bad at all. It's a little bit of redness and swelling. It actually looks kind of good because it looks like you have tear trough filler while you're recovering from your laser. For about a week after the V-beam under eyes, you'll be like a little bit pink and puffy under the eyes, and it actually looks kind of good because it's adding volume under the eyes too. It's one of my favorites, and a lot of patients just love under eye V-beam to erase dark circles, and then you won't have to worry about wearing concealer. All right, you guys, that pretty much sums it up for under eye rejuvenation. If I think of anything, so I'm doing this all off the top of my head and straight from my brain. If I think of anything during this flight that I forgot, I'll hop on here and add it at the end. But I think for most intents and purposes, this is a pretty comprehensive video. Drop a comment in the comment section if there's anything that you feel I missed or anything that you want to address for under eye rejuvenation. I think the only thing I didn't talk about was a lower lid blepharoplasty or surgery, but that is out of my scope of practice as a dermatologist. And for that, I would refer to my oculoplastics colleagues or my plastic surgeon colleagues. So everything we recommend is non-surgical for under eye rejuvenation and energy-based device or laser focused without needing surgery, which is great, because then you don't have to worry about the downtime and scarring and some of the complications that you have to worry about with surgery. But sometimes if people are severe enough where surgery is going to be, the best outcome, and that may be an option for many of you guys, then go for it, and go make sure that you get, a second, third, maybe even fourth opinion by a highly trained oculoplastic surgeon for under-eye blepharoplasty, if that's the route you want to go. All right, you guys, we'll see you in Miami. Maybe I'll check my comments and just see what you guys have to say, and we'll be sure to get back to you. All right, anyways, love you guys. So always 30 minutes before I land, I use my ECM eye serum and my under-eye masks so that my under-eye skin is nice, hydrated, plump, smooth, and firm when I land.
Air JetBlue, especially this LAX and Fort Lauderdale.
Good to see how cute this is. He always can fall asleep on a plane. I get so jealous. Here I am all hyped up. I'm about to do some work, read some journal articles, and update my continuous medical education, reading about all the latest pathways and developments in the field of dermatology. But I'm just type A. That's where I am. All right, I love you guys. We'll see you soon. Yeah, but I have to show everybody with your under eye gels. Ooh, your periorbital area is so hydrated. So just getting off the plane, y'all. So drinking lots of water, using under eye serums and under eye gel masks, it just is like such a godsend, because usually when you get off a plane, the cabin humidity and moisture containing air in the water in the air isn't as dense, so you get a lot of transepidermal water loss, which can make you feel like crepey and dehydrated and all wrinkled and dry. So I always make sure I wear my under eye patches. I put on my ECM eye serum, and I also just maintain good fluid status by drinking lots of water. I also have my MDR lip mask on my lips and my necktie serum on my neck, so I'm all nice and shiny and hydrated when I get off the plane, not like a deflated little raisin instead. Thank you so much for watching. Drop a comment in the comment section and share this video with someone who may find it useful. As always, I love you guys.